Hi, I'm Sarah Dawkins, and here for some APP insights on non-invasive testing. So common questions from primary care providers. One of the biggest questions I get is, I have a patient who got abdominal imaging and they happen to have hepatic steatosis, but normal liver tests. What do I do? Do I refer to hepatology? What do I tell the patient? So first, I always want to make sure that there's no evidence of advanced liver disease or like splenomegaly or any concern for portal hypertension or cirrhosis. But if they had normal liver tests and kind of a steatosis on the liver, you always want to make sure that they aren't using alcohol, or if they are, they should reduce or abstain. And then always get a FIB-4 score. So get the FIB-4, especially if they have risk factors for if they have diabetes, or if they have 2 or more cardio or metabolic risk factors, or any liver test abnormalities, of course. But the FIB-4 should be tested. And then if that's low risk, just counsel the patient on lifestyle modifications like alcohol abstinence, good control of diabetes, good control of blood pressure, hyperlipidemia. And if they're overweight, would focus on weight loss. So no need to refer to hepatology unless that FIB-4 becomes abnormal or if there's concern for more advanced gut fibrosis. And then another question I get sometimes is, what about patients who have a mild ALT to AST ratio that's been elevated for years? Do they need to see hepatology? So if the patient has risk factors for metabolic liver disease and they have that ALT to AST ratio that's ALT to AST is greater and it's been mild, I'll always rule out viral hepatitis and iron overload, kind of a limited serologic evaluation. But if they have a FIB-4 score that is low, they do not need to see hepatology. Making sure you're ruling out any other drug-induced liver injuries, supplement use, alcohol use. But if they have very low, mild elevations in their transaminases, they can get the FIB-4 score and you can assess that way. So thank you for joining me on this APP Insights, and I look forward to speaking with you soon.